The use of oral oncolytics continues to be very important in the treatment of our cancer patients. I think oral oncolytics tie in nicely with my advocacy for molecular profiling. Many of the mutationally driven cancers are in fact best treated with the small tyrosine kinase inhibitors, oral biologics that are most effective against those types of cancers. I think that with the coming of immunotherapies and the ease of giving an IV administration over 30 to 60 minutes, some physicians are tempted to put the oral therapies on the back burner, and I think that would be a mistake. I think that where it's appropriate, some of these targeted oral therapies are probably the most relevant and most impactful drugs for patients to take. There is still a lot of education, learning, toxicity management, symptom management to occur around giving oral therapies. So having an oral therapy given to a patient doesn't mean they're not going to come into the office, but I do think that many of our therapies can be given as well orally, and particularly some of the small molecule targeted biologics. Lastly, we're already seeing the new versions of immunotherapies coming along orally. So we now have in phase 1 clinical trials some oral immunotherapies, and I think they'll be a key part of the movement in terms of how best to use immune therapies to treat our patients.